Thank you for joining us once again. I am at the Cross Insurance Center today, and this actually is one of the areas that we use to draw up that precious vaccine. Start off with some good numbers. As of this morning, we have 12 total inpatients within our system that are positive for COVID-19. 7 of those are at Eastern Maine Medical Center, 1 at Maine Coast Hospital, 1 at Mayo Hospital, and 2 at Mayo Hospital and 2 at Mercy Hospital. And in addition to that, our home care and hospice team is taking care of 3 individuals who have COVID-19 at their home. A quick vaccine update. As of 3/9, we have administered a total of 72,810 doses of vaccine. That represents 47,828 first doses, 24,982 second doses. Yesterday was a big day for Northern Light Health, where we vaccinated 4,339 individuals across the state, where over 2,100 of those individuals were here at Cross Insurance Center here at Bangor. In addition to that, 77% of the vaccine doses that we've administered have been in individuals over the age of 70, meeting the mandate of the governor. So we're very proud of that fact. A few updates. According to the new CDC guidance, people who are fully vaccinated may gather with others who are fully vaccinated without masks in their homes or in other intimate settings. This is excellent news and a predictor of the normalcy that we will be able to return to once everyone has had the opportunity to be vaccinated. More than ever, we want to stress how important it is to be vaccinated when you are given the opportunity. Until that time, please continue to mask and physically distance we are so close to winning the battle against this pandemic. Until the majority of our population has had the chance to be vaccinated, it is important that we continue to mask. It is also important to note that these guidelines do not pertain to healthcare settings. So community members will still be asked to mask while they're in our facilities for the protection of patients, visitors, and staff. We are now in our second week scheduling Maine residents over the age of 60 and above for vaccinations in accordance with the governor's office and the Maine CDC. We are also vaccinating school staff and teachers who are age 60 and over. Beginning in next week, we will expand that to all age groups of school teachers and staff and childcare workers. In preparation, later this week, appointments will open up for school staff and licensed childcare providers of all ages. The link to the scheduling tool specifically created for school staff and licensed childcare providers is being shared by the state and the Department of Education with those groups. We will not be sharing that link at this time. This group will be required, like healthcare workers, to provide proof of licensure, employment, with the school ID, pay stub, or proof of certification. People should not share this link with friends and family because those who are not eligible for vaccine will be turned away. Just a quick update on some of the newer vaccine sites that we have that Northern Light Health has set up. The Piscataquis Ice Arena, as many of you know, we are working to set up a vaccination clinic in that location. We are pleased to say that work has begun to set up the infrastructure we will need. If all goes according to plan, we expect to open the site on Friday, March 19th. Our goal is to eventually reach about 1,500 vaccinations each week at that site. Mercy Hospital, the operator of Portland Expo vaccination site, is ramping up vaccination efforts after a successful first week. The Mercy team successfully vaccinated 510 people on its first day and received a lot of positive feedback. Yesterday, it topped over 1,000 vaccinations and continues to increase as vaccinations supplies allow. The new site is now open Tuesdays and Thursdays by appointment only. Registration is available on our website on Monday and Wednesday afternoons, just like our other clinics. If you'd like to learn more about this new vaccination location, please visit Mercy Hospital's Facebook page to view a helpful video about what the experience will be like when you get to the expo from start to finish. And then here at the Cross Insurance Center, we continue to hold vaccination clinics Tuesdays, Wednesdays, Thursdays, and Saturdays. And we continue to increase the number of people that we can vaccinate as more vaccine is able to reach us. And then around our other sites around the state, we continue to do the same. And with that, I'll open it up for questions.
Okay, thank you, Dr. Jarvis. We'll start today with TJ, ABC7. You should be able to unmute now, TJ.
There we go. Good afternoon, Dr. Jarvis. How are you?
TJ, I'm fine. How are you?
I'm pretty darn good, but that's just my opinion. Anyway, you mentioned these sites that are in the works. Are there plans for any other sites to try to spread the vaccine more quickly and more widely?
So we continue to look at ways that we can improve our process, as well as look at how we can have greater vaccine distribution across the state. We are looking at locations in Hancock County, but at this time I have no further details on that. But we are still proud of the facilities that we have in many of our other counties. Air Gould site up at Northern Maine Community College, and SVH and Inland site at Kennebec Valley Community College. Those are up and running and doing very well. And then our two sites in Hancock County between Blue Hill Hospital and Maine Coast Hospital are also continuing to run. But like I said, we're trying to build a larger facility. If and when we have details on that, I will share them.
A couple of weeks ago, I believe it was, you all put a call out for volunteers. It's been a couple of weeks now. What kind of response have you gotten?
We've gotten tremendous response to our call for volunteers. Not only have individuals reached out to us, but communities, businesses, and local government officials have all reached out. And so at this time, we continue to have a waiting list for volunteers. We still need to staff our clinical staff. So that includes pharmacists and pharmacy techs to be able to draw up vaccine, and those who are able to do vaccinations. And so we continue to work on getting those people processed. I know there's a lot of people who have signed up to volunteer, who are in the waiting queue. And again, we ask for patience on that. Again, it is wonderful news that people are so interested in giving of their time for this effort, and we appreciate it.
Thanks, TJ, for your questions. Next up, we have Patty White, Maine Public.
Thanks very much. Hi, Dr. Jarvis.
Hey, Patty, how are you?
Doing well, thanks. How are you?
I'm doing pretty good. It's a good day here at the Cross Center.
Yeah, and actually, so I just wanted to quickly check something. You said that it was big news that you had vaccinated about 4,300 individuals or over 2,100 at the Cross Insurance Center. I missed why that was big news. Was that the most you've done in a single day?
Yeah, I'm sorry. Yes, that is exactly right. It's the most that we have done as a health system in one single day, as well as the most that we have ever done at the Cross Center. So big news for us.
Yeah, definitely. And then I was curious how the signups for vaccine appointments are going. At the beginning of this rollout, you were inundated with calls and your website crashed, but I'm just curious, are you seeing the same volume of calls and demand each week when slots open up? What's that been like?
Yeah, as we've lowered the age for eligibility down to 60, we see the same surge that we saw when we first started to vaccinate those age 70 and above. So there is still a wonderful demand for vaccine, and unfortunately, our supply can't keep up with that demand. But it is good news for all Mainers that there's such a great interest. I will say that there was some good news this week. We fixed some issues that we had with our online registration program. Basically making it so that more people can access the site at the same time. And then we built a waiting room that allows people to kind of be put in the queue for when they can access the site. We did have some technical issues with that at launch, but this week it went smoothly, and we were able to service many more people in a much shorter amount of time on Monday. And so that was good news for us and good news for the state of Maine.
All right, thank you, Patty. Next up, we have Allison Ross, WMTW. Allison, you should be able to unmute now.
Perfect. Well, thank you so much for taking my question today. So I just have one question here. Oh, can you hear me?
I can. Go ahead.
Perfect. So just one quick question. It seems like we're getting fewer doses of the vaccine over the next 2 weeks. So the federal goal is to have teachers have at least one dose by the end of the month. Do you think that will really impact that goal? And do you think we could still achieve the goal of having teachers get at least one dose of the vaccine?
Yeah, so Allison, there's a lot of factors that go into whether or not we can meet that goal of having educators, staff, and childcare workers having at least their first dose of vaccine by the end of the month. The first, of course, is vaccine and making sure we have that supply. We do have the supply here on hand that will get us through our scheduled clinics for this week and next week. But we are concerned by the fact that there may be a dip in the coming weeks and how that will affect our ability to vaccinate not just educators and staff, but also everybody in the state of Maine. And then the other factor is just the coordination of it. As you know, this news came on us pretty quickly last week. And there's a lot of logistical things that have to be put behind that go on behind the scenes that have to be put in place for us to do that. It is not an insignificant number of people that are now eligible in this category. And so as we work through those details, but I can say that, we have been vaccinating teachers over the age of 60, and that has gone well so far. And we will continue to do that through this week. And then next week, hopefully we will see that we'll be able to vaccinate more teachers, staff, and child care workers of any age. So more to come on that, but we do worry about vaccine supply all the time.
Wonderful. Thank you so much.
Okay, thanks, Allison. Next up, we have Portland Press Herald, Eric. You should be able to unmute now.
Thank you, Andy, and good afternoon, Dr. Jarvis.
Good afternoon, Eric.
I wonder if there's been a lot of good news with vaccines and vaccinations. I wonder if you can talk a little bit about any challenges you've noticed, particularly in areas where gaps that have been identified in getting vaccines to people who might have transportation issues. I know the state announced a plan yesterday to help those people, but have there been other sort of challenges in, identifying people who may have additional challenges in either getting to the cross arena or in connecting online? What have you seen for challenges there?
Yeah, I'm just going to reiterate that it's Cross Insurance Center here in Bangor. The
Yes.
arena's down in Portland.
I should know that.
Yeah, it's okay. I just want to clarify just for viewers' sake. So we have seen challenges with people with transportation issues. I will say that we are trying to fill those gaps as best we can. Northern Light Health's own home care and hospice agency has been going out, particularly in counties that are more rural and don't have as much access to large facilities for vaccination. And particularly in communities of individuals who are older. And so whether that be actually at a long-term care facility or in an assisted living facility, or just simply a community that is designated for people who are older. So we have been making outreach into those groups. We are still concerned about those individuals who struggle with internet access, and that's a concern across the state. We need better broadband, not only to be able to have people be able to sign up for vaccines, but also so that we can continue to expand upon our telehealth process so that we can reach people for all their healthcare needs and not just for vaccine. It's why Northern Light Health did set up a call line to help those individuals. And we also applaud those community members who've been able to step up and help the members in their community who have struggled finding a way to access either our website or the state's website or any other vaccine clinic's website. So yes, that is a concern. I continue to be concerned about our western counties where Northern Light Health and frankly, every healthcare system does not have a major presence. And so we do want to make sure that we're reaching out to those individuals. But right now, we are still in that kind of role of that vaccine demand outpaces supply. So it is not a question of us not using vaccine because of those gaps, but we need to continue to fill those gaps in. So thank you for that important question.
The one other question I had, if I may, and it's in a similar vein, but you must have patients within the Northern Light Network, of which there are tens of thousands, who are still unsure about whether they want to get the vaccine. And these might be people older. This might be people who are going to become eligible soon. What's the process for educating those people about why it's so important? I know you talk about it when you do these things. I know Dr. Shaw talks about it and others, but is there an individual way that you're connecting with patients who might still be skeptical?
So certainly any one of our practices, that discussion can come up. And so if people have specific questions and concerns about their own health, they should reach out to their primary care provider, and their primary care provider can certainly assist them. At the state level, there is a committee that is working on education for both providers and for the general population to assist. I will tell you that probably the best thing that's been happening to us is really the positive news we've been seeing on social media from Mainers who have been standing up and saying, I was proud to be vaccinated and you should get vaccinated too. And here's how the process went for me. And so it should be good for you. And because of that, we have seen people who initially were hesitant, individuals, healthcare workers who were hesitant to get their vaccine early on are now coming up and saying, hey, listen, I saw my coworkers who were vaccinated. They were fine. They feel great. I want to get vaccinated now. Similarly, we saw that happen in our long-term care facilities where initially there was some vaccine hesitation. And now we've seen that many of our residents of our long-term care facilities have stepped up. And then in addition to that, we say the same thing with individuals over the age of 70 who have said, hey, this has gone so well for my friends and neighbors. I want to get vaccinated. So really that word of mouth is probably the best thing. What we know is people are less hesitant to get a vaccine when they know somebody who received the vaccine and did well and can tell them that the vaccines are safe and effective. You know, I can continue to say this over and over again, but I'm just one person and I don't go out to every single community. And so we really need those in the community to step up and say, hey, these vaccines are safe, these vaccines are effective, and these vaccines are the only way we can start to have that sense of normalcy again. So thanks.
Thanks, Eric, for your question. Next up, we have Bangor Daily News. David, you should be able to unmute now.
Great. Thank you, Dr. Jarvis, as always. At this point, have there been any changes in how Northern Light Health plans to utilize the Johnson & Johnson vaccine? Do you think they will be utilized more at remote locations, like you mentioned previously? Have you done any more examinations of using them at the Cross Insurance Center as of today?
So that's a great question about how Northern Light Health intends to use Johnson & Johnson. Some of that will be based on the factor of how much we actually get into the state, what our other vaccine supplies look like. We continue to have discussions internally as well as with our partners across the state as to how best to utilize any of our vaccine supplies, but in particular the Johnson & Johnson. As you're aware, at least for the next week and probably the next 2 weeks, the amount of Johnson & Johnson vaccine coming into the state will be very low. So it will not be a major player for us right now. But as their production ramps up and we see more of a supply, I could easily see that that vaccine will not only be used to reach out into our more rural communities, but we may be able to have the opportunity for the vaccine to be supplied to some of our practices. And so people could actually receive the vaccine while they're being seen for a regular health appointment, and possibly even be able to be vaccinated within a hospital admission as well. And then to be able to use that vaccine in a large scale clinic, such as what we have at the Cross Insurance Center or down at the Expo in Portland. So all of those are on the table for us. As I've said before, if there's one thing that healthcare does well, it's vaccinations. We do that every single day. We have no problem dealing with multiple vaccines. Every year, we usually have up to 5 different influenza vaccines on our facilities at any given time and have the ability to manage those without difficulty and making sure that the appropriate vaccine is given to the appropriate person. And so we do not feel it would be a major challenge for us to add a particular vaccine to one of our sites or another. So we see lots of promise with the Johnson & Johnson vaccine. We just need to have it arrive.
Thank you for clarifying that. There have been some issues in the past with the vaccine registration portal, including lengthy, incorrect listed wait times on Monday last week. I was wondering how registration went this past Monday and what has been done to address some of the issues that users have presented, including some who've presented them in the comment section of Northern Light Health's Facebook page.
Yeah, so we try to take every comment and concern seriously, and we look into as many of them as we possibly can. We did have some issues with the quote waiting room a week ago Monday, but we solved those issues. We did not have any of that happen this past Monday. In fact, as I said before, several thousand people were able to be registered for their vaccine in a very short amount of time. And partly that's due to the waiting room function that we added. It allows more people to access the site and not have to keep hitting refresh. And so that went very well today. In fact, I spoke to 2 couples today who had scheduled their vaccine using it. One when they had the inappropriate wait time number, and one that went through the process this week. The first couple said, yeah, we knew that it wasn't really going to be a 4,000-minute wait, and we waited, and it was about 5 minutes, and then we got into the site, and we were able to schedule. And then the other couple said, yeah, we were in the wait room, and it was only for a matter of seconds, and we were able to get through. Now, obviously, those are just 2 examples, but we have heard that things have been going much, much better. Again, we are not a website design company, but it's wonderful that we have staff here who have expertise in being able to do that. But our primary function is healthcare. And so, and that is always going to be our primary function. But we will continue to try to improve and get things as smooth and go as easily as they do when you get to the actual vaccine clinic itself.
Great. Thanks for your questions, David. It looks like we lost WABI. They had to drop off, so we do have a few extra minutes. If anyone has questions, if you'd like to ask another question, just let us know in the chat and we'll unmute you and you can have a third question. We'll give it 30 seconds. All right, Patty, you mentioned that you have a question. I will unmute you now. You should be good to go, Patty.
Thanks. I was just curious, Dr. Jarvis. I mean, you talked about preparations for vaccinating school staff under age 60. How worried are you that it's going to slow down the pace of vaccinations, that the logistics involved of having to identify teachers could sort of slow down your efforts?
Yeah, so the question was, do we feel that when we start vaccinating teachers and other staff and childcare workers under the age of 60, if that will slow down logistics? So we're already working on the logistics for that. In fact, we expect that by 2 p.m. today, we will have most of the logistics worked out. Thankfully, the Department of Education will be the ones who are notifying most of these individuals that they are now eligible and how to sign up for this for a clinic schedule. Once that process occurs, it's no different to us whether we are talking about the population over age 60, healthcare workers, first responders, teachers, or staff. Our process is pretty similar. I will say that it'll be interesting to see those particular individuals coming through our large vaccination clinics. As I said last week, it was a little bit different seeing the age over 60 versus the age over 70. And it'll be interesting to see a large number of younger individuals come through. Everybody has their unique challenges and their unique questions, but at the end of the day, I'm just happy everybody is happy that they got their vaccine and things have been going as smoothly as they have been. So thank you for that, Patty.
Okay, and David, Bangor Daily News, you mentioned that you have a follow-up too, so you should be unmuted now, Dave.
Hello again. I had another question about Johnson & Johnson. We've looked at these clinical trials of the Johnson & Johnson vaccine. I wanted to ask you, as a medical professional, there has been some worry I've heard about people seeing that it's maybe less effective than Moderna and Pfizer. But then other people say the vaccine mutations we've seen might be because of that. They were tested at different times. Do you have any impression of the effectiveness of Johnson & Johnson versus the other vaccines? And do you worry at all about people hearing about this kind of information and not wanting to get the Johnson & Johnson vaccine?
So I do worry about people trying to choose which vaccine to get. I will continue to state that the best vaccine for you is the one that's offered to you first. And that really needs to be the message right now. And it's not the time to pick and choose. And frankly, people don't pick and choose which vaccine they get when we talk about influenza shots. They're just happy to get one of them. And the same should be here. As far as efficacy goes, Johnson & Johnson's vaccine clinical trials occurred at a different time than Moderna and Pfizer trials did. And it did occur in more countries and while we were seeing some of these variants. So the good news is that the Johnson & Johnson vaccine appears to be very effective against these variants, and that's good news. We're finding out now because we have those variants around the country that the Moderna and Pfizer vaccine are also good for them. It was the endpoints that was really what makes the difference in those percentiles. And so it's really key that we start comparing apples to apples and not apples to elephants. And the reason why I say that is because that's what the endpoints were very, very different. So if we look at the critical endpoints, hospitalizations from severe disease and death, there is almost no difference between Pfizer, Moderna, or Johnson & Johnson. They're all almost 100% effective 28 days after administration of your final dose of whichever vaccine it is in preventing hospitalizations and death. That is remarkable. When we talk about efficacy of vaccines, we're usually talking about numbers like 35%, 45% efficacy. Remember that the federal government and the World Health Organization set the goal as being 50% effective. We're talking about 100% effective. So these vaccines are incredibly safe. They are incredibly effective. And again, the best vaccine for you is the one that's offered to you first. So thanks for the question.
Okay, it looks like that's the final question for today. So with that, we'll wrap up the media conference. As I mentioned at the top, we do provide a high quality video file of the media conference. If that's something you'd like, just let us know in the chat and we'll send that over to you as soon as it's ready. Thanks again for joining us today. We appreciate your help with getting the word out. And Dr. Jarvis, I'll turn it back over to you for the final word.
So today was a more upbeat press conference than we've given most of the time. Lots of good news out there. But again, I want to remind people, we are not at the end of this tunnel yet. We still have a long ways to go. So we still need people to remain safe by staying masked, not gathering outside their own household. And no matter what, wash your hands. And with that, I'm going to say thank you and good afternoon to everybody.